A complete blood test, which is CBC, is the most common kind of blood test. It's normally done during a routine checkup. A CBC measure they measure many different parts of your blood. A test can be help detected for any blood disease or any blood disorders. This includes any if you have anemia, infection, clotting problems, if you have blood cancers, and immune system disorders. Red blood cells, they carry oxygen from your lungs to the rest of your body. If you have any abnormal blood cells, levels may be a sign of anemia, dehydration, when you don't have enough fluids in your body, any bleeding, or other disorders. White blood cells are part of your immune system, which helps you fight off any infections and diseases. If you have abnormal white blood cells, the levels may show a sign of infection, or if you have any blood cancer or an immune system disorder. The CBC measures the overall number of white blood cells you have in your blood. Another count looks at the amount of the different types of white blood cells that are in your body. Platelets are blood cells that help your blood clot. They're what stick together to seal any scratches you may have to stop the bleeding. If you have abnormal platelet levels, it may be a sign of a bleeding disorder. That means you don't have enough clotting, that you just continue to bleed, or you may have a thrombotic disorder, which means you have too much clotting. Hemoglobin is an iron-rich protein in red blood cells that carry oxygen. If you have any hemoglobin levels that are abnormal, it may be a sign that you have anemia. You could have sickle cell anemia. You could have thalassemia or any other blood disorder. If you have diabetes and you have extra glucose in your blood, it can attach to hemoglobin to raise the level of hemoglobin A1C. Hematocrit is a measure of how much space the red blood cells in your body take up in your blood. If you have a high level, it can mean that you are dehydrated. You want to make sure that you start drinking more fluids, or if you have a low level, it might mean that you're anemic. Also, any abnormal signs, maybe a sign of any blood or bone marrow disease.